Welcome GOLD participants from around the world. I'm Fleur Bickford, Program Director and MC for GOLD Midwifery. I'm here today chatting with Dr. Alison Hazelbaker, who is talking with us about her upcoming presentation titled Infant Trauma, Its Impact on Breastfeeding. So Alison, thank you so much for being with us today.
Well, thank you for having me. I just love being a participant and a speaker for GOLD.
And we always love having you. We're thrilled to have you back with us. So we're going to talk a little bit about your presentation, and I know that this one on infant trauma, this is a new presentation for you. So I would love it if you could tell us a little bit about what triggered your interest in creating this specific presentation.
Well, it's a new presentation and yet a very, very old interest of mine. And being a developmental psychologist and a baby myself who was born in the 1950s and was a victim of the childbirth practices of the time, not only has it been personally relevant, but as I see what's going on around me in terms of our cultural childbirth practices and what subsequently happens developmentally for our infants that turn into adult human beings, and being a psychologist who works with those adults, I decided that probably the best way to prevent some of the problems that I work with as a psychologist is to start to create some awareness around what happens to our babies who are conscious, cognitive human beings even as they are in utero.
Okay, thank you. And I think that that's a really important point that, just hasn't been given a lot of attention, up until now. It seems to be, it's only recently that, we're starting to talk about the fact that, infants are cognitive beings and they're aware of their surroundings. And so it's definitely interesting, and I'm really looking forward to this presentation. So normally when we think of birth trauma, we're focused on the mother. So maybe you can just give us a little bit of a sneak peek into your presentation and tell us a little bit about infant trauma and what that means.
Well, trauma is a very specific term in psychological circles. We kind of throw it around a lot, maybe a little bit more looser than we should, but it is something that happens very easily to vulnerable, immature beings like babies. So they are the most vulnerable of us, and when their central nervous system gets overwhelmed and they're powerless to get away from that overwhelming amount of stimulation, trauma can happen. So that's a little sneak peek.
Okay, so tell us a little bit now about what you hope the delegates will take away from your presentation. What do you hope they're going to learn and be able to take back and apply to their own practices?
An awareness that that babies are more vulnerable than their mothers as a result of what happens in utero while they're developing and in the interpartum and neonatal periods. An awareness that perhaps will help them to change the way that they support women, change the way that they support the babies, and help them to think twice about some of the things that we just automatically do without understanding or thinking about the ramifications for the baby and their psycho-emotional and physical health.
Okay, Alison, thank you so much for chatting with me today and giving us a little bit of a look into what's coming up in your presentation.
Thank you, Fleur.
Okay, so for our delegates who are listening, you can hear more from Alison during her live presentation on February 29th, and that will be at 2200 UTC. So we look forward to seeing you online then. Goodbye for now, everyone.